So I'm going to try to answer a question that we've had about how we deal with the various things that can bother people about their nose, such as a drooping tip or an overly wide nose, um, reduction in the length because some people their nose is too long or it seems that way. A lot of what we notice in the nose has to do with our ability to really discriminate this central portion of the face. That's how our brains are wired so that we can identify each other. We may miss somebody having that isn't actually how it is, but if somebody's missing part of a finger, we may not even notice that for quite a while. But if something's just a little bit off in the nose, we can see that. Same with the eyes. And that's why these areas are so noticeable and bothersome to a lot of people. Some of it has to do with previous trauma, some of it has to do with your genetics. There are lots of reasons. So when we're looking at somebody's nose in terms of how it appears, then we're looking at how all of the underlying structure relates to itself. In other words, once we're in there, can we release whatever force is pulling the tip of the nose down? Or perhaps the tip of the nose isn't really down, but the bridge of the nose is too high. So if the bridge of the nose is too high, then we can reduce that um, by removing some bone and cartilage. If the problem is that the tip really doesn't project adequately, then we have to figure out ways to bring it up so that it does project better and probably put in some grafts and sutures to hold it in the position that we want it to be in. Now, in terms of the width of the nose really relates to the bony structure. So in the skull, where the bone is, we can make this a little more narrow by cutting the bones and allowing them to come in. That also will allow us to narrow the cartilage portion as well. In terms of the tip, then modification of the tip cartilages to make the desired shape may necessitate having something called an open or external approach rhinoplasty, where there's a tiny little incision underneath, otherwise all the incisions are inside, that can allow us to trim and reshape the cartilage. Sometimes we have to add on cartilage grafts that we can get from the septum or occasionally from the ear. But that's basically how we do these things. It doesn't really change the recovery postoperatively, and most people are really pretty comfortable after a rhinoplasty, surprisingly to pretty much everybody. Occasionally, of course, with any operation, there is always risks and potential issues, and some people are more sensitive than others, and everybody's response is not exactly the same. But for the most part, people are pretty comfortable after this.